Hello, everyone. In today's episode, we are going to talk about the most common kind of cancer, skin cancer. 2 people die of it in the United States every hour, and 1 in 5 develop it by the age of 70. It is by far the most common kind of cancer. It's affected senators, musicians, and actors, but if caught early, it has a survival rate of 99%. My name is Taylor Cordum, and I work at Allina Health as a member of the Learning and Development team. I'll be facilitating this conversation today to help us learn about skin cancer and answer some common questions related to prevention, detection, and treatment of skin cancer. With us is Dr. Elizabeth Farhat. Dr. Farhat is the lead dermatologist at Allina Health practicing out of the Bloomington and Bandana Square clinics. She completed medical school at Northwestern University in Chicago and residency at Henry Ford Hospital in Detroit before returning to Minneapolis to be closer to her family. She enjoys spending time with her husband and children, traveling, cooking, and loves riding her Peloton. Welcome, Dr. Farhat. Thank you so much for being with us today.
Thank you so much for having me.
So let's talk skin cancer. I've heard that there is more than one kind of skin cancer. Is that true?
That is correct. There are 3 different types of skin cancer. The most common type of skin cancer is called basal cell. Now, basal cell can grow locally, but rarely spreads to other areas of the body, so it's the least aggressive type of skin cancer. The second most common type is called squamous cell skin cancer. It can occasionally spread to other areas of the body, but melanoma is the most serious type of skin cancer because it can spread internally and lead to more serious complications.
Interesting. Good to know. How is skin cancer diagnosed?
The great thing about skin cancer is typically we can see it with the naked eye. So we diagnose it by doing a visual inspection of the skin, and then we perform a skin biopsy, which is a scraping of cells to have them analyzed underneath a microscope, and that will determine if they are cancerous cells.
So I've heard a lot of people call that exam by a lot of different names. I've heard mole map, mole scan, skin check. What's the difference between those?
So they're all pretty much the same thing. Typically, we call it a full body skin examination, and that is also referred to, like you said, a skin scan or skin check. And that's where we look you over head to toe. You come into our clinic, you put on a gown, and we basically just take a look at your skin for any suspicious growth. So we use a special magnifying glass during this exam called a dermatoscope, and that helps us to look at the architecture of different moles and growths on your skin.
Okay, sounds good. I'm worried that if I ever had to get anything removed or anything scraped off with a biopsy that it might be painful. What does that treatment typically involve?
That's a great question. So when we do a skin biopsy, we always use a numbing medication before we do the scraping. So that's called lidocaine, and it's the same thing that they use at the dentist. So it's a little poke and a burn, but that causes the area to be numb for several hours, and so you don't actually feel any discomfort during the biopsy. And then similarly for treatment of skin cancer, most skin cancers can be treated with that local numbing medication, and you don't need to be put to sleep for most of the skin cancer treatments.
Okay, that sounds pretty manageable. While we're talking here, I've been looking at my own skin, and I see that I might have some moles here and there. What warning signs should I be looking for?
So for your moles, those are the brown spots on your skin typically. We have you look out for those ABCs. So A stands for asymmetry. So when you look at your moles, if one side does not look like the other, we would call that asymmetrical. B is for irregular border. So if it has a nice round border, that is fine, but an irregular border would mean there's areas that are jutting out. C is for the color, so really dark color or multiple colors. If you see 2 or more colors in the mole, that can be concerning for skin cancer. D is for the diameter, and classically we talk about a diameter greater than a pencil eraser or 6 millimeters. So a lot of the small moles we don't worry about as much, but those bigger moles that are growing in size. And then the E stands for evolution. So if something starts bleeding, rapidly growing, or changing, you know your body the best. So if you notice anything changing, that's always a warning sign. And then for non-melanoma skin cancer, just for growths, we always look out for bleeding, scabbing, or non-healing areas. If you have a sore that never goes away, that's always a warning sign. I often have patients come and say they have an acne bump that never healed over or a bug bite that just never went away. That means that something abnormal is going on with the cells in the skin if it's not healing over.
So what are some common areas where skin cancer might occur then that people might not realize?
I think the most common that I see is on the top of your scalp. So unfortunately, that is the first place that the sun likes to hit, and it's also a place that's pretty much impossible to see on yourself. So I've diagnosed both melanoma and non-melanoma skin cancer very frequently on the top of the scalp. That's why it's important to wear a hat when you're out in the sun. The other weird areas would be spots in between your toes or on your feet. Those are areas that people, again, don't check frequently, but definitely if something pops up, I have found melanomas in those areas. And then also in the groin. I know that sounds like a weird area for skin cancer, but we definitely find skin cancers in areas that never see the sun. So that's always something else to look out for.
So I know a lot of people kind of correlate the sun with skin cancer. So with that information, what is the best way to reduce the risk of melanoma?
The best thing that you can do every day is to protect yourself from the sun. So the most important thing is sunscreen when you're out in the sun, SPF 30 or higher. And so the other thing I really love is sun protective clothing. So they have clothing that has UPF that's in the material. The sun protective clothing, you don't have to reapply. You can just put it on all day. So also hats and then sunglasses are really important to protect your eyes from the sun when you're out in the sun. And then the other thing is just to remember to reapply the sunscreen every 2 hours. Most people get the sunscreen on once in the morning and then they go out, go for a walk, play outside, go gardening, go play golf, and they forget to reapply it. And so that's when a lot of the sun damage occurs, is when you forget to reapply that sunscreen.
Great. So I heard you say that SPF 30 or higher is the best sunscreen to use. What do those numbers on the sunscreen bottle really mean?
So SPF actually stands for sun protection factor, and that is the amount of protection that you get from the sunscreen. And so typically SPF 30 is going to block 97% of the sun's rays. If you go higher in the SPF, it'll block even more, but obviously, SPF 100 is going to be up to 99%, so it's more of an incremental benefit. So we always just recommend looking out to make sure it has both UVA and UVB protection. All of those sunscreens should be labeled broad spectrum sunscreen. And then the other thing is obviously looking for water resistant or waterproof sunscreen if you're going to be out in the water, boating, or anywhere that you would be sweating. And then the two different types of sunscreen that there are on the market are chemical blockers and physical blockers. Chemical blockers are the ones that absorb the sun's rays, and the physical blockers are the ones that are going to reflect the sun's rays. The physical blockers are going to be the ones with zinc oxide or titanium dioxide.
Okay, so I heard that sunscreen actually might be bad for you, though. So what's the truth around that?
So like we were just talking about, they have noticed in some of those chemical sunscreens that there is absorption of some of the chemicals into the skin. And so if you are concerned about that, you can definitely focus on those physical blockers, and those are the ones with the zinc oxide and titanium dioxide. Now, with that absorption of the chemicals that they found, they have not seen any problems or any issues with that, but just if you're concerned, I always recommend doing a physical blocker.
Oh, sounds good. So I've also seen that there are different sunscreens out there for infants and babies. What do you recommend for them? Is it safe for them to actually use that sunscreen?
Yeah, so really young infants, I always like doing more sun protective clothing, keeping them in the shade, hats, covering up strollers with blankets or things like sun protective material. But if you are going to be out in the sun, you can use the baby sunscreen, which is the same thing as the sensitive skin sunscreen, and that's the one that has only the zinc oxide, titanium dioxide. It's the physical blockers, so those are safe to use on our kiddos and babies as well.
Oh, good. I'm glad that we have protection for them as well. So I work from home, and I'm inside all day, so would I need to put sunscreen on if I'm just going to, sit at my desk all day?
So if you're totally inside and there's no sunlight coming in, you should be fine. But sunlight actually can come through windows. So if you're sitting by your window on a sunny day, you are getting sun through the window. Glass typically only blocks UVB, and so you're still getting that UVA through the window. And so similarly, if you're driving in your car, I have people that say they never go outside, but they'll drive in their car. And so even like a 30-minute commute, you're still getting sun through your car windshield. We always see more skin cancer on the left side of the face and left arm because of that sun exposure from driving.
Oh, interesting. So what about people that don't use their sunscreen very often? Can you use sunscreen from 5 years ago? Does sunscreen ever expire?
It does expire, unfortunately. I know we all have little tubes of things in our houses that we hope we can still squeeze a drop out of, but check the expiration date. They should be printed on the sunscreen. The maximum length of usage for sunscreen is 3 years per the FDA. But they did find that using expired sunscreen is actually better than using no sunscreen. So if you have no other alternative, it's just not going to work as well as new sunscreen. But especially if it's more of a physical blocker like the zinc oxide or titanium dioxide, that should still work pretty well.
Oh, good to know. I might have to go out and buy some new sunscreen then. So in the summertime, I love sitting outside with a book or sitting by the pool and just getting those rays and tanning my skin. But is tanning in a tanning bed better than tanning outside?
No, actually, tanning beds are now classified as class 1 carcinogens, similar to smoking cigarettes. So they found that even using a tanning bed once can increase your risk of skin cancer. And this is because the tanning beds have that unopposed UVA, which causes that DNA damage. And that DNA damage is irreversible. So even if you've just used, I have a lot of patients that did tanning beds before vacations, but just that minimal use can increase your risk for melanoma.
Oh, okay. Well, I've heard some people say that their skin doesn't burn, it just tans. Is that true? Can some people have skin that doesn't burn?
Unfortunately, anytime you have that skin darkening, even tanning, that is a sign of DNA damage. So there's no such thing as a healthy tan, unfortunately. I have patients that never burn that still get skin cancer, and that's because they haven't had to use as much sunscreen to prevent burning. They end up getting even more sun over their lifetimes.
Oh, okay. Good to know. So, different topic. I've been reading and hearing a lot about climate change and how that's affecting our world. Does climate change affect our risks of getting skin cancer?
Definitely. So there are areas where the ozone layer has been thinning due to climate change, and that is causing a lot more sun damage. For example, in Australia, they have the highest rates of skin cancer due to the decreased ozone layer in that area.
Okay, well, I'm taking a trip to Mexico soon, so is there anything that I would need to do differently to keep my skin safe when I go on vacation rather than what I do here in Minnesota?
Absolutely. So the sun is a lot stronger the closer you get to the equator. And also, if you're going on a ski trip, the sun is a lot stronger at higher altitudes. So you definitely want to double down on your sun protection. And I talked about the sun protective clothing, hats, sunglasses, and then just making sure that you reapply every couple hours to prevent sun damage.
Okay, sounds good. Well, after talking about all of these things, I'm interested in talking with my doctor as well, but I'm kind of worried about how much that might cost. What information do you have about whether skin cancer checks are covered by insurance?
So most insurance companies do cover a skin cancer screening, so that full skin examination that we talked about, but I always recommend checking with your insurance company just to make sure. Also, just a reminder to all the patients that May is Melanoma Awareness Month, and so every year the first Monday in May is called Melanoma Monday, and that's where dermatologists across the country offer free skin cancer screenings, especially aimed at those who do not have health insurance or are prohibited by the cost of getting their skin checked. And so we have those offered at Alina, but across the state I've seen many other dermatology providers that do those free skin cancer screenings in May, so you can always look that up. I found many melanomas and non-melanoma skin cancers at these events, so it's definitely good to get checked out even if you're unable to have it covered by your insurance.
Oh, that sounds great. I might have to get that put on my calendar. What else can I do to learn more about melanoma, or what other resources do you have?
So I like to point people to skincancer.org that has a lot of good articles and information about skin cancer and melanoma. The other thing I really like is the American Academy of Dermatology. They have information for patients, and that is all reviewed by board-certified dermatologists, so that's a good trusted source. Or I also recommend talking with your doctor about any questions you have about skin cancer or skin health.
Those sound like awesome things for us to use to get more information about melanoma and skin cancer. Thank you so much for talking with us, Dr. Farhat, about all of these melanoma and skin cancer topics. There's been a lot of really helpful information. We're really happy to have had you today.
Oh, it's been my pleasure.
So everyone listening, you are in charge of your own health, and skin cancer is a perfect example of where you can take real action to determine your health journey. Make sure you look at your skin regularly, wear sunscreen, and don't delay. If something feels wrong, schedule an appointment with your doctor right away. Skin cancer is highly treatable if caught early. If you have any further questions, be sure to talk with your doc.